We could have a biomarker that gives someone some confidence, that we could show them a picture in the brain saying this does look like the child who has the type of brain of an ADHD child, versus this is a normal brain or a typical brain, and maybe your child is just inattentive because he has a boring teacher, or because you're fighting a lot at home and your child is just nervous because of the fighting. That would make it much, I think, easier for parents to accept treatment when it's needed. Because the truth is that psychiatric illness in children is not only common, it's quite treatable. And on top of that, children who have these disorders can go on and live wonderful lives if they get the treatment they deserve.
You know, it almost reminds me of a child that might have a broken leg. And of course you go to the orthopedist, and of course you have it set, and you have a cast on. And why wouldn't people have the same attitude towards mental problems in children? They should also seek out the help, and you describe a resistance, and hopefully this will be overcome.
I think physical illness is a little bit easier because you can see it. I think sometimes seizures, because we're both old enough to remember there was a time when if someone had a seizure disorder, you actually hid that fact from everybody. And that if you had a seizure disorder, you wouldn't be able to drive a car, and you were afraid that people would marry your sister or your brother because this craziness was in your family. And then once people were able to measure seizures with EEGs or with MRIs, and we had medications that could literally change the electrical misfiring of the brain, somehow seizures lost their stigma. Our hope is that once we can show the neurological component, the fact that this isn't a mother's fault or a child's weakness that they have these disorders, I think Americans will be more likely to not only embrace, by the way, medications, but embrace effective, evidence-based psychosocial treatments, whether they're parent-child interaction therapy or whether it's cognitive behavioral therapy for obsessive-compulsive disorder, treatments that we know work so much better on young kids and on teenagers than they do on adults.
Incidentally, Dr. Koplewicz has written a compelling book called It's Nobody's Fault, which I really recommend to everyone to read. I have a question about outreach programs into schools. Are you planning anything like that with the local schools?
Yeah. So I think more importantly than even the local schools, we think that, like Willie Sutton said, the reason he robbed banks was because that's where the money is. The reason why we work with schools is simply that's where the kids are. Teachers know children better than anybody else. If you talk to a group of parents, they'll tell you that they have 3 children, so their sample size is 3. If you talk to a good teacher who has 25 kids in her class every year of 3rd graders, so she knows 8-year-olds, and she's been teaching for 10 years, she knows 250 8-year-olds, she's going to tell you a lot. And more importantly today, because of budget cuts, many schools are eliminating special education or exclusion programs so that you're getting inclusion, and therefore teachers more so than ever really really have to have skills in classroom behavior and classroom management. And if they can't do that, they end up spending so much time on the child who's making the most amount of noise that the other kids actually are suffering from it, because school is supposed to be a place of learning, not a place for psychiatric treatment. Yet teachers have to have these kinds of skills. So we're now working on a pilot program with Teach for America. We're working on a program that we're in discussions with the Board of Education here in New York City, again, to see if we can establish programs that can be not only sustainable, but that can be replicated across the nation. One of them, which I think is most interesting, is based on a program called Parent-Child Interaction Therapy. In Parent-Child Interaction Therapy, we work with parents whose kids are disruptive, who are off task.
Did you start that?
That program was actually started by a group of people at the University of Florida, but we have become, are becoming the largest training site for clinicians in PCIT. And PCIT teaches parents what behaviors they should ignore, what behaviors they should actually stop, and what behaviors they should praise. And if your kid is doing lots of things that you don't like, when they do something that you do like, you tend not to praise it. You tend to ignore it, and that's not good. And the way we do this is we train parents about these skills. We evaluate the child by observation. Sometimes we actually go to school and observe. And then we give a parent a receiver that they put in their ear. And either through a one-way mirror or through cameras and a computer screen, we are able to tell parents when they should ignore things, when they should praise, and if they're not praising enough, how to praise, and when to stop behavior that is really quite destructive. And it works fast, in 6 to 10 sessions. And now we are transforming that into teacher-child interaction therapy, where we ask a teacher to take their most difficult child, who they're having difficulty managing, out of the class and to work with that child in front of us, and we give them the skills that if they can work with the most difficult child in praising them, in ignoring certain behaviors, and stopping certain negative behaviors, they can then generalize those skills for the whole class. So a good example of that would be one child is constantly raising their hand, and the other children in the class don't raise their hand. If you constantly call on the child who raises your hand, the other children won't answer anymore. They will give up. If you ignore the child who's raising their hand, then that child after a while will stop raising his hand also. But what's a young teacher to do? Well, we teach that school, that teacher, to slap that hand and say, that's a good hand. I like that hand. Can you show me some other hands? And so it's not the question or the answer that we're looking for, it's the behavior of raising your hand that we're trying to teach teachers, that just by changing certain of their behaviors, you'll get more of the kids to raise their hand, and then maybe figure out if the kids are giving you the right answer or not.